Hello guys, today we'll discuss craniology. Craniology first part is cranium and the second is facial bones. First we have cranial bones. In cranial bone we will going to discuss frontal bone, and this is frontal bone which I draw. This is the frontal bone, and frontal bone consists of three parts. Three parts in Latin you can para sequema, para orbitalis and para nasalis. In English we can say this is this one is sequamous part. This one in orbit, this is the orbital part. And this, the red one, is a nasal part. These are three parts which we discuss in the frontal bone: para sequema, para orbitalis, and para nasalis. Now each part have formation. First we will discuss the sequamous part. Sequamous part which I already wrote. This sequamous part. Okay. Now each sequamous part formation. Which formation we have? This area. This is the frontal tuber. These are frontal tubers. This one. This area is called supraorbital margin. Supraorbital margin. In Latin, supraorbitalis, margo, supraorbitalis, margo or margin. Okay. Now next, this area. This is supraorbital notch, which like the U shape. This is a supraorbital notch. First supraorbital notch. In Latin, supraorbitalis, incisura supraorbitalis. Incisura. Notch means incisura. Incisura. And this one, this is incisura, and inside the incisura we have supraorbital margin. Supraorbital foramina. Supraorbital foramina. Now next formation of the sequamous part we have, the middle side, this one. This is a frontal foramina. Frontal foramina. Foramina frontalis. Now next formation we discuss margin. Now like this shape, like if you will see in the real bone, you will also like see this type of on the bone is supraciliary arches. Okay, supraciliary arches or arcus. Both side we have. Next formation what we have, if you will come into the lateral side we have which bone in cranium? We have temporal bone, then we have temporal there, and here we have zygomatic bone. Okay, and this connection with zygomatic bone here, this area is called zygomatic process because this connection with zygomatic bone. Zygomatic process. And here in temporal side we have temporal line, and like this temporal line and temporal line, or linea temporale. Next formation we have temporal surface or fascis temporalis. Okay, temporal surface. This the formation of squamous part of frontal bone. This all formation which we discussed, this is formation only in squamous part in frontal bone. Okay, first again we will repeat which surface we discussed. Frontal tuber, this is frontal tuber. Next we have supraorbital margin. Third we have supraorbital notch first, incisura supraorbitalis, and then we have inside foramina. Okay, this is foramina and first notch. Then we have frontal foramina, this is a frontal foramina. Okay, now this which we like upward protrodes area, this is called supracellular arches. In and next in laterally we have the zygomatic process, which connection with zygomatic bones, and we have temporal line and temporal surface laterally. Okay, and there is one only formation between two supra arches. These are two between two frontal tuber, and between two supra arches we have glabella. Okay, here we have glabella. This which we discussed, this only the formation in the squamous part of the frontal bone. Okay, next part we have orbital part. Okay, the next part of the frontal bone we have second part, we have orbital part of frontal bone. Orbital part we will going to discuss formation. Which formation we have in orbital part? Orbital part, the first we have two fossas. One is here and one is here. Okay, two fossa we have. One is lateral side, lateral fossa, and one is a medial fossa. Medially, lateralis and medialis. Okay, lateralis we have lacrimal fossa, this one, and medially we have trochlear fossa, or fovea trochlearis. Okay, again here I will show this is lateral, and this is a medial. Lateral and medial. Laterally we have lacrimal fossa, and medially we have trochlear fossa in the orbital part. You know, this is not whole, this is the whole orbital cavity, but for frontal bone, this which the suturing which I draw, this area, this part only for frontal bone. Okay, and this area we have medially we have trochlear fossa, and laterally we have lacrimalis fossa in frontal bone. Okay, next bone, next part we have frontal part. Frontal bone. We have nasal part, pars nasalis. Pars in Latin. You also need to remember the in Latin language. If you want to study in Russia, then you need to study also prepare in Latin also, because mostly professors are asking in Latin language also. This area which I draw, this is the nasal part. Third, nasal part here and here also. Nasal part or pars nasalis. Okay, now which formation we have here? Formation we have here nasal margin, nasal crest, and front ethmoidal notch. And also we have, again we will repeating the formation because I was a little bit silent. Here the nasal part we have four formation. Okay, first we have nasal margin. You can see this is the nasal part. You can see from the inner side very well, because here is we have nasal bone, and nasal we have nasal margin, nasal crest inside. Okay, like this nasal crest, and then here we have opening for opening from frontal sinuses. Here we have opening for frontal sinuses. we also have frontal sinuses. Okay, we have frontal sinuses, and inside in the skull we have, like this is, we have sagittal sinuses, and we have internal or frontal crest inside frontal crest, and front is between frontal skin and crest agali we have ethmoid bone there, because ethmoid bones are located in the interior cranial fossa. Between crest agali and frontal crest we have foramen cecum. Foramen cecum is located, and here is like U shape. This is called ethmoidal notch or incisura ethmodalis. Okay, these are four formation which we discussed. These are in the nasal part: nasal margin, nasal crest, ethmoidal notch, and frontal sinuses. This formation in the nasal part. Okay, this is with the finish and very easy bones. Like summary, we will going to repeat. We have ethmoidal frontal bone, os frontalis in Latin. We have three parts. This one sequamous part, we have orbital part, and we have nasal part. Frontal part is called parasequema. Nasal part we call paranasalis, and orbital part is called paraorbitalis. And each part we have formation, like we discussed in front sequamous part we have frontal tubers, okay, supraciliary margin and supraorbital notch, supraorbital foramina, and then we have medially we have frontal foramina, okay, and between two supraciliary we have glabella, okay, glabella. Laterally we have zygomatic process in temporal surface, and zygomatic process in temporal lines. Okay, these three formation also laterally in the sequamous part. Then we will go into the orbital part. Orbital part we have two fossa. Laterally we have lacrimal fossa, medially we have trochlear fossa. Okay, and then nasal part we have four formation. Inside you can see easily nasal margin, nasal crest, and ethmoidal notch, and frontal sinuses. Okay, this is about the frontal bone.